What are the long-term psychological effects of female genital mutilation? Have you ever wondered how a cultural practice can impact a person's mental health for a lifetime? Female genital mutilation, often abbreviated as FGM, is one such practice that has severe and lasting psychological effects. Let's take a closer look at the long-term mental health issues that many women face after undergoing FGM. Women who have experienced FGM often report high rates of post-traumatic stress disorder, commonly known as PTSD. Studies indicate that nearly half of these women may suffer from PTSD, which is comparable to rates seen in survivors of early childhood abuse. This trauma can lead to ongoing struggles with depression and anxiety. The emotional scars from the procedure and its consequences can linger for years, affecting daily life. The feelings of betrayal and loss of trust can be overwhelming. Many women undergo this procedure at the hands of family or community members they trust. This betrayal can lead to behavioral problems and difficulties in managing emotions, which can further lower self-esteem. Another serious psychological effect is sexual dysfunction. Many women experience painful intercourse or a lack of sexual desire, which can create distress and strain intimate relationships. These issues often stem from the trauma associated with FGM, making it hard for women to engage in satisfying sexual activity. Cultural factors do not provide protection against these psychological harms. Even in communities where FGM is a long-standing tradition, women still face trauma symptoms. Some may even underreport their psychological struggles due to stigma or cultural taboos surrounding the topic. However, the trauma can manifest in various ways, including chronic pain, flashbacks, and avoidance behaviors, which can worsen mental health. The psychological impact of FGM also extends to family and community dynamics. Women may face challenges during childbirth, which can be traumatic and further affect their mental health. The pain and trauma linked to FGM can create a cycle of submission, reinforcing gender inequalities and limiting autonomy. This raises important ethical concerns about bodily integrity and human rights. From an ethical standpoint, the long-term psychological effects of FGM highlight a conflict between respecting cultural practices and protecting individual well-being. While moral relativism recognizes cultural diversity, the severe and lasting harm caused by FGM challenges the moral acceptability of the practice. Ethical frameworks that prioritize human dignity and freedom from harm argue against FGM, emphasizing the need for prevention, education, and support for survivors. Addressing the psychological effects of FGM requires culturally sensitive mental health services and community-based efforts to change harmful norms while respecting cultural identities. The goal is to protect individuals from harm while balancing moral pluralism with universal human rights principles. By understanding these long-term psychological effects, we can work towards a future where women are empowered and free from such practices.